Introduction. Massage is the scientific manipulation of the soft tissue of body with the palmar aspect of hand and or fingers. In massage, there are three types of lubricants are used: oil, powder, and cream. Classification. Here are some bases of classification of massage. Classification on basis of character of techniques. Positioning and draping for massage. Stroking. Superficial stroking. It is the rhythmic movement of hand or parts thereof over the skin with lightest amount of pressure in order to obtain sensory stimulation. Superficial stroking can applied through palm of hand, pulp of finger, knuckles and ball of thumbs.
Superficial stroking. Superficial stroking is performed with the palm of hand or with the pulp of finger. Patient position, supine lying. Therapist position, in box standing. In start, right hand placed on most proximal end of the segment to be massaged. Direction of massage is proximal to distal. As the right hand move toward the distal part, the left hand should also move in proximal direction by a controlled and combined movement of both hands. Movement should be performed in rhythm.
Deep stroking, also called as effleurage. It is the movement of the palmar aspect of the hand over the external surface of the body with constant moderate pressure. It is done in the direction of venous and lymphatic drainage. Each effleurage stroke should be as deep as can be applied without causing discomfort to patient. Effleurage for back.
In this technique, therapist can use one or both hands. Usually the palmar aspect of hand, finger or thumb are used. Therapist position is box standing. Start massage from most distal part of segment and end to the nape of the neck. For upper back, direction of drainage is supraclavicular lymph node. For middle back, direction of drainage is axillary lymph node. For lower back, direction of drainage is inguinal lymph node. During massage, be aware about the pressure on body is remaining same during whole procedure. The rate of stroking should essentially be slow, at least 10 to 12 strokes per minute.
Effleurage for hand.
Patient position, supine lying. Hand should be elevated. Therapist position, oak standing. In this technique, therapist hand at most distal part of hand. Usually palmar aspect of hand is used. The entire length of segment is covered in one row. Hand should be relaxedly placed over the skin and during massage the pressure should be remain constant. And be aware patient don't feel discomfort. In ending position, drainage done in axillary lymph node. After drainage, the hand is brought back to its starting position with returning stroke. The rate of stroking should be essentially 10 to 12 strokes per minute.
Effleurage for face. Start.
Effleurage for face. Effleurage is directed from midline of the face to just below the ear or subauricular gland. Taking care that as you stroke, you do not constantly move the earlobe. As much of the palmar surface of the hand as possible is used to start the stroke. The finish is always with the finger press. The first stroke goes from under the chin, used for full hand.
Kneading. In this technique, tissue are pressed down on the underlying structure and pressure is applied in circular way. The pressure is increased and decreased in gradual manner. The hand should be placed firmly on the skin so that the movement can take place only in the deeper structure and not over the skin. Each circle overlaps the previous one. Type of kneading. There are three types of kneading: palmar kneading, digital kneading, and reinforced kneading. In digital kneading, there are two types: finger kneading and thumb kneading. Palmar kneading.
Palmar kneading, therapist position, walk standing position, patient position, forearm, supine line, for calf and thigh, prone line. For example, here we are applied massage over calf. Position of hand. The palm is placed relaxedly on the distal aspect of limb. Finger and thumb are not kept in contact with the skin. Hand over skin should not be changed, and throughout the maneuver, the hand and skin should move as one. The pressure is gradually increased during one half of the circle till it reaches to the maximum level at the top of the circle. The other half pressure is decreased gradually till it reaches a minimum at the bottom of circle.
Digital kneading. There are two types of digital kneading: finger kneading and thumb kneading. Finger kneading. In this technique, only one finger may be utilized or two or three fingers can be used together to increase the contact of area. Little finger is usually not used considering its short length and inability to apply sufficient pressure. Whole finger needling. In this technique, 2, 3 and 4th digit which are held together to make both contact of area. Finger pad kneading. In this technique, uses the contact of pulp of finger which is otherwise called finger pad and more apparently can be described as the palmar surface of distal phalanx. During this technique, the DIP and PIP joint of the needling finger should be kept in little pegs in order to allow adequate contact of pulp. Fingertip kneading. In this technique, only tip of finger is used.
Thumb kneading. In this technique, one or both thumb is used. It's depend on size of area. Other finger should not touch to the skin or little away from the area to be massaged. Thumb pad kneading. It's as same as finger pad kneading and done in smaller area. Thumb tip kneading. It's as same as fingertip kneading and done in smaller area.
Reinforced kneading.
Reinforced kneading. This technique also called as ironing. Most commonly, this technique is performed over the back. Therapist position, walk standing, patient position, prone line. The hands are placed over each other and the lower hand remain in contact with the skin and then start applying kneading.
Petrissage. In this technique, the tissue are lifted away from the underlying structure and intermediate pressure is applied at the right angle to the long axis of bone. In this technique, we use picking up, skin rolling, and ringing. This technique involves lifting of the tissue up at right angle to the underlying bone, squeezing and releasing it. It is most commonly performed with one hand only. Therapist adopts a walk standing stance. The hand is placed on the body part in such a way that the web space between the thumb and index finger lies across the center line of the muscle bulk and skin to be lifted. The thumb and thinner remnants are placed on one side and index finger with hypothenor remnants are placed over the other side of center line. Arm kept in position of slight abduction and elbow in semi-flexion position. The grasp of hand is tightened along with the little extension of wrist. This produces the stimulation, lift and squeeze of the grasp tissue. Then the grasp is loosened and transfer of body weight, releasing the compression again. In this way, the sequence to be lift, squeeze and release is performed. During the picking up, the web space between the thumb and index finger should always remain in contact with the skin.
Skin rolling. This technique involves lifting and stretching of the skin between the thumb and the finger as well as moving the skin over the subcutaneous tissue. The therapist lift up and move the skin and superficial fascia with both the hands, keeping a roll of the skin raised continuously ahead of the moving thumb. Both the hands are placed on the skin with thumb abducted in such a way that tip of thumb and index finger of both the hand touch each other, maintaining a full palmar contact with the skin. The technique is initiated by pulling the finger backward with sufficient pressure so that skin is pulled up. If done correctly, it lifts up of the skin. At the same time, the thumb is adducted and opposed with downward pressure over the underlying skin. The coordination of finger and thumb motion lift off a roll of skin from the underlying structure. Next, the palm is gradually lifted off the skin so that the lifted rolling of skin remain between the tip of finger and thumb. Then the thumb are moved forward to roll the lifted skin against the finger.
Bringing. The grasp and placement of hand are similar to that of picking up, with only difference that in this technique both the hands are used. The technique is initiated by pulling the fingers of right hand to pull and lift the skin from underlying structure. At the same time, left thumb pushes the skin in opposite direction. It is an extremely useful technique for mobilization of the adherent skin.
Friction. In this technique, small range of oscillatory movement which applied to the deeper structure with the pressure of thumb and fingers. There are two types of friction, circular friction and transverse friction.
Circular friction. This technique is applied in a circular motion with thumb. In this, no phase of relaxation and a constant deep pressure is applied to the tissue. This technique is applied around localized area. The fingertips are placed over the localized area and little pressure downward. The skin and finger are moved in circular direction. Transverse friction. In this technique, direction of the movement is transverse. It can be performed with tip of the thumb. with pressure either forward or backward movement is performed in small range so that the patient's skin and the therapist finger are moved as one. The force of friction can be generated by alternate flexion and extension movement of finger or thumb and cannot be performed for longer duration.
Percussion. This technique is the application of intermediate touch and pressure to the body surface. All techniques of this group utilize the controlled and combined movement of the wrist and forearm to strike patient's body surface rhythmically. These techniques are described below.
Clapping. In this technique, the hands are cupped. The technique is executed by the controlled and rapid flexion extension of wrist. At no time movement at elbow should be allowed. It is performed during both inspiration and expiration and should not apply under pressure on the soft tissue of chest wall. Manual percussion is normally performed at a rate of 100 to 480 times. This technique is used for relieving the spasm. It should not produce pain to the patient and need not be forceful. And also, clapping be applied over the blanket or towel covering the chest or back. It helps to avoid sharp skin stimulation and pain. Clapping can be taught to the patient suffering from chronic respiratory disorder so that they can self-percussion and loosen up the viscous secretion.
Hacking. In this percussion technique, only the ulnar border of medial three fingers are used to strike the skin. The fingers are held loosely apart so that the ulnar border of middle ring and little finger come successively in contact with skin during its strike. This produces a peculiar sound. Hand should be completely relaxed with finger held loosely apart. Alternate supination and pronation of the forearm combined with ulnar and radial deviation of the wrist respectively produce the hacking. Movement of elbow is not allowed at all. This technique is very useful for relaxation point of view and it employed over large areas such as back or thigh.
Tapping. This technique is useful when intermittent touch and pressure are to be applied over a small area. In this technique, only tips of the finger pads strike the body part. Either one or both the hands may be used. Fingers are held loose and are relaxed. Alternate flexion and extension of the metacarpophalangeal joints produce the tapping. The wrist and elbow should be kept flexed and no movement is permitted in this joint. Commonly it is used over face, neck and other smaller areas. It can be conveniently used on children.
Beating and pounding. In this technique, a loosely clenched fist is used to strike the body part. Either one or both hands may be used. There are two techniques are named. First, beating. In this technique, entire aspect of the fist strike the part. Second, pounding. In this technique, the lateral aspect of fist strike the part.
Beating. In this technique, making a fist, the fingers are flexed at PIP and MP joint, but the DIP joint are kept extended so that a flat surface compressed on dorsal aspect of two distal phalanx in produced on the anterior aspect of fist. The beating is produced by the alternate flexion and extension of wrist as used in clapping. Movement at the elbow is not permitted as it may transmit excessive force. Pounding. In this technique, making the fist, all the finger joints MP, PIP included DIP are flexed. Thumb relaxed over the ring finger. Supination and pronation of forearm combined with the ulnar and radial deviation of the wrist respectively produce the pounding. The action in pounding is similar to that used in hacking. These two techniques are commonly used over the back, thigh and other fleshy and large area of body to obtain relaxation. Tenting. This technique is a modified of clapping. The concavity is produced between the index and the ring finger with the middle finger is slightly elevated and placed over them. Over the smaller chest of the newborn baby or a premature infant can be struck with this technique is very effective for loosen of the viscid secretion.
Vibration. In this technique involves constant touch of therapist's hand with the patient's skin and the application of rapid intermediate pressure without changing the position of hand. Therapist position box standing. One hand is placed over the other which remains in contact with the chest wall of patient. To perform vibration, therapist transfer his body weight to the patient's chest through the extended and stabilized upper extremities and tense up all the arm and shoulder muscle is co-contraction. This produces oscillatory movement of his hand in upward and downward direction and transmit the mechanical energy to the patient's chest. Vibration is always performed during the expiratory phase of respiration.
નાકેથી ઊંડો શ્વાસ લ્યો અને ધીમે ધીમે મોઢેથી છોડો. ફરી પાછો નાકેથી ઊંડો શ્વાસ લ્યો અને મોઢેથી ધીમે ધીમે છોડો.
Shaking, patient position, side lying, therapist position, box standing. Both the hands are placed over the chest wall, over the affected lobe. Shoulder is adducted and elbow is kept slightly flexed. We are performed shaking on lateral chest wall. Shaking is done only during expiration phase.
નાકેથી ઊંડો શ્વાસ લ્યો અને મોઢેથી ધીમે ધીમે છોડો. ફરી પાછો નાકેથી ઊંડો શ્વાસ લ્યો અને મોઢેથી ધીમે ધીમે છોડો.